Hi everyone, Dr. Steph Chaney here from Living Health Integrative Medicine, and I'm here to talk to you guys about the difference between type 1 and type 2 diabetes. Even though primarily what we work with as far as reversal of diabetes in our office is helping type 2 diabetics reverse their disease, we do see a lot of type 1 diabetics or combination type 1 and type 2, and we get a lot of type 1 diabetics that ask us before coming in, can you even help me? I have type 1 diabetes. So I just want to clarify the difference between the two, and then to verify that yes, we can help people that have type 1 diabetics get healthier, but at that point it's going to depend on the pancreas function. So for a long time it was juvenile diabetes and adult onset diabetes, and that was how they delineated it. What we have discovered is that children can have type 2 diabetes, and as well as juvenile type 1 diabetes, but adults can also get type 1 diabetes, and they're not juveniles, so we can't really use the juvenile and adult term anymore to delineate it. So here's how it gets discussed. If you are autoimmune, meaning your immune system is now attacking your pancreas because of either an infection or food reaction or allergies, some type of inflammatory process has caused your immune system to attack your pancreas, then over time that destruction of the pancreas will lead to a need for you to get insulin into the body from an external source. You become an insulin dependent type 1 diabetic. It generally is an autoimmune condition, and it can happen in childhood. More often than not, a young child that comes down with like a diabetes diagnosis, they are type 1 and they are autoimmune. As an adult, it can happen, but it gets a little fuzzier because more often than not, adults are also dealing with type 2 diabetes. Type 2 diabetes is where your pancreas is functioning and it's outputting insulin, but the sugar levels have gotten so high and your insulin receptors on your cell membranes are either shutting down or can't repair themselves, and you are not able to accommodate or handle or listen to the insulin to take sugar out of the bloodstream and into the cell. You have insulin resistance, meaning you're not able to use the insulin that your pancreas is making. This is a type 2 diabetes situation. You may start off as an adult with type 2 diabetes, but as an adult you can develop an autoimmune condition where you start to attack your pancreas. And so you can, as a type 2 diabetic, start becoming also type 1, and they have a name for that. They call it diabetes type 1.5. And this is a latent adult diabetes autoimmune condition, otherwise known as LADA or LADA. And essentially, it's not much different than what happens in childhood, except that it's happened to you as an adult. They're rarely testing for this because it may not change the actual conventional treatment plan. Sometimes patients are told by their doctors, you're type 2 diabetic, over time your pancreas is going to go kaput and you'll probably need insulin. This is extremely unfortunate because then the actual cause of these conditions do not get handled. We have helped people that we have discovered have type 1 diabetes where they have an autoimmune condition attacking their pancreas, but we catch them early enough and we save the pancreas and they don't end up needing insulin, or they're able to come off insulin. Obviously, if you have completely destroyed your pancreas and there's literally nothing left, you will likely be an insulin-dependent diabetic for life. But anyone, including children, that started off as type 1 can also develop insulin resistance and type 2 diabetes if they're not managing and correcting things very well. And so this is where we can come in and actually help a type 1 diabetic get a better handle on their disease and prevent or reverse the type 2 component that they may be having, which then allows them to lower insulin and get healthier. I know that was a lot of information, but it can be a confusing topic for a lot of people, and I hope that helped clarify the difference between type 1 and type 2.